Imagine this. It's late at night, you feel something unusual, and you start wondering, is this labor or not? This is one of the most confusing and sometimes scary moments for many pregnant women. And the truth is, missing the signs of labor or misinterpreting them can delay getting the care you need. In this video, I'm going to walk you through the real signs of labor every pregnant woman must know, and how to recognize them, and most importantly, when to go to the hospital. And welcome to the Obstetrician's View. I am Dr. Elizabeth Nonubari Obidino. I'm a consultant obstetrician and gynecologist, and I help you understand pregnancy in safe, practical, and simple ways. If you're pregnant, planning pregnancy, or supporting someone who is, this video is for you. Let's break this down step by step so you feel confident when the time comes. So what is labor? Labor is the process your body goes through to deliver your baby. It involves regular uterine contractions, gradual opening of the cervix, which is the mouth of your womb, and eventually the birth of your baby. But here is what many people do not realize about labor. Labor doesn't always start dramatically or suddenly. It can begin subtly, and that's why you need to know the early signs of labor. So, what are the true signs of labor? Number one, regular painful contraction. The most important sign of labor is regular uterine contraction. These are not the same as the occasional tightening you may have felt during the course of pregnancy. True labor contractions come at regular intervals, say after every 5 minutes, after every 10 minutes. They tend to become progressively stronger and they tend to last longer. They do not go away with rest or with ingestion of mild analgesics or painkillers. At first, they may feel like menstrual cramps or lower back pain. They gradually progress to become more intense. So if you are a second or third time mother and you do not want to go to the hospital too early, a good way to monitor the contractions is what is called the 5-1-1 rule. This simply means that you monitor it, time it, and you notice contractions every 5 minutes lasting about a minute, and you have monitored this for about an hour. You know that labor has begun. You will need to go to the hospital. So the second is show, which is bloody mucus discharge. You may notice a thick mucus discharge, usually clear or sometimes has a streak of blood. This is called show. It happens when the mucus plug sealing the cervix, that's the mouth of your womb, comes out, indicating that the cervix is beginning to open. This can happen hours or even days before labor starts. It does not always mean immediate delivery, but it's a strong sign that your body is preparing for labor. The third is rupture of membrane or water breaking. This is when the fluid around your baby leaks out. It may happen as a gush of fluid or slow trickle. The fluid is usually clear, but sometimes slightly yellowish. But very importantly, once your water breaks, you should go to the hospital. Now, let me take a moment and say this. Even if your contractions have not started, whenever, wherever, whatever time it happens, please go to the hospital. This is very important. If the fluid is green or foul smelling, this is even more urgent. Do not wait at home. The next is cervical changes. This is something that only your healthcare provider can confirm. So during labor, your cervix softens, it thins out, and then it opens. This is why even if you're unsure, it's always safer to get checked rather than assume. It's always safer because sometimes your cervix may begin to open without contractions. For some women, it happens like that. So it's better to get checked and do not just ask. Some women experience loose stool, nausea, or even vomiting Okay, this is one of your body's natural way of preparing for labor. It's not always talked about, but it's quite a common finding around the time of labor. So let's talk about false labor, known as Braxton Hicks. And this is something that confuses many women. But here is how to know the difference. False labor usually presents with irregular contractions. These contractions do not increase in intensity. That means they do not get increasingly painful or get more severe. They usually may stop with rest or with hydration, and there are no cervical changes. That means that the mouth of your womb is not progressively or gradually opening up. But true labor will usually present with regular contractions. The contractions get stronger and more closer together. They do not stop. They lead to cervical dilatation. So if you are in doubt, just go and get checked. So when should you go to the hospital? You should go to the hospital immediately if you notice the following: regular contraction. Remember the 5-1-1 rule we talked about earlier. If your water has broken, guys, let me take time to emphasize again that wherever, whenever, whatever time you notice your water break, please go immediately to the hospital. It's very important. Okay, so if you notice vaginal bleeding that is more than just show, you have reduced or absent baby movements, you have severe abdominal pain, severe headache with blurring of vision or swelling of your body, please go to the hospital. Do not wait for things to settle. Labor can progress faster than you expected, so go to the hospital if you notice any of this. So let me give you some quick preparation tips. Before labor starts, make sure your hospital bag is ready. By that I mean it should be packed, kept at a particular place so that you can quickly whisk it when you think labor has started, and it will contain everything that you need for the hospital, or someone can help you get it and it will contain practically everything that you will need in the hospital. Also know your route to the hospital. Make arrangements for how to get to the hospital when labor starts at any time of the day. You should also have an emergency contact saved on your phone. Once you think you're in labor, inform your birth partner. Preparation removes panic and helps you stay in control. Labor is a natural process, but being informed makes it safer and less frightening. Remember, your body will give you signs. You just need to recognize them. If you found this video helpful, don't forget to like, share with a pregnant friend, and remember to subscribe to the Obstetrician's View for more trusted pregnancy advice. I'll see you in the next video. In the meanwhile, go get your bag packed.